Good afternoon. Thank you for joining us. BC's Chief Coroner Lisa Lapointe will join us in a few minutes. A new report from her office says BC needs access to non-prescription safe supply drugs. The province has said no. So where do we go now on BC's toxic drug crisis? Plus, David Eby meets with other premiers and territorial leaders, and we'll hear what he had to say on the topic of the carbon tax debate. After 12:30, this year's Vancouver Asian Film Festival tackles mental health and stigma. Is mental health still taboo among your community? I'm Michelle Eliot. Welcome to BC Today. Thanks for joining us on CBC Radio 1, live streaming on CBC Gem, cbc.ca/BC, and on the CBC Vancouver YouTube page. Well, every month, BC's Chief Coroner Lisa Lapointe releases a report of the number of deaths due to the poison drug epidemic. And every month, the numbers keep climbing. An average of 6 people a day die in this province. And at least 13,000 have died since the province declared a public health emergency in 2016. Now, last week, a panel examining the crisis called on BC to greatly expand access to a safer supply of drugs, including non-prescription access. BC's health minister has turned that idea down. We're asking you, where do we go from here with BC's toxic drug crisis? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. And BC's Chief Coroner Lisa Lapointe joins us now. Good afternoon.
Hello, thank you for having me.
Thanks so much for joining us. The report from last week from the death review panel found that about 225,000 people remain at risk of drug injury or death in our province. How was that number arrived at?
Well, that's some modeling that's done from the medical health officers. The SFU has a significant research team there. So, I mean, it is, I guess, a bit of a best guess, but based on analysis of a number of things, including drug checking use, supervised consumptions visits, a rate of substance dependency diagnosis. So a number of factors go into that number.
And how much does that concern you? The number of people, 225,000 at risk, and the number of people who have died so far this year?
It's shocking, frankly, and I only heard that number just recently that modeling was done. We had earlier known that about 100,000 people in our province have an opioid use disorder. And then we knew on top of that there were people who, used drugs but maybe not had not been diagnosed with an opioid use disorder. So it's a very alarming number, and I think it gives some sense of why we've continued to see so many deaths across our province for so many years, where we are losing 6 people every day and have been for more than 2 years now from toxic drugs.
And this year's report from the death review panel now believes that more safer supply needs to come, and that access needs to be expanded, and that needs to come from outside the medical system. So no need for a prescription. Why do you think that's necessary?
Yeah, so the panel was very, very thoughtful in its findings and in its recommendations. And there's a few things that we know for sure. So if we have 225,000 people at risk, absolutely, the panel supports treatment and recovery. We know the province has 3,277 publicly funded beds. Now, beds is a funny amorphous term that we're not exactly sure what it means, but in terms of 225,000 people at risk, 3,277 beds. There are at any given time about 4,700 people currently having access to safer supply through the medical model. Mm-hmm. So again, less than 5% of those with an opioid use disorder have access to safer supply, and maybe 1% of those who use substances more broadly across the province. So it's really, in terms of capacity, a real struggle to try to support people to wellness with the available tools. We know our healthcare system is stressed, and this is something that the panel spoke about, that, currently there are thousands of people in our province without a medical doctor. The healthcare system has lineups for almost every door that you're trying to access, and it's no different for treatment and recovery programs. There are long waits for services, and while they are waiting, people are dying because the toxic drug market is relentless. We know it's a profit-driven market, and it continues to try to, it's not a passive market, it's continually trying to recruit new users. And certainly we know from the modeling, 225,000 people at risk. So the current responses, the panel supported, but the panel said this is not enough. We will not prevent these deaths in the urgent need we have right now without broadening access to safer supply.
BC's health minister expressed real reticence about that, and she said that what we need to work on right now is expanding the current supply of the current program of safe supply, and she felt that taking it out of the medical system would mean a lack of medical oversight. I mean, is that not a reasonable concern?
Absolutely, it is a reasonable concern, and the panel was very, very thoughtful in that. And I should note that the panel was made up of a number of subject matter experts from across the province, all of the medical health officers, the deputy provincial health officer, addictions medicine specialists. We had police representatives on the panel, the representative for children and youth. So people with extensive experience and background. And the recommendations were very thoughtful. They recognized the potential for diversion. They recognized the potential for some harms. The challenge is, of course, balancing those risks with the current reality that 6 people are now dying every day. So I think what the panel said very clearly, we recognize there is some risk. Here are the things that need to happen to mitigate those risks. And they were very thoughtful in those in their report. But when we are in a climate where 6 people are dying every day, day after day, week after week, month after month, year after year, we need to be more innovative in our response. And the current medical model just does not have capacity. When the medical system is already so stressed, adding another 225,000 people is just not feasible. And that's why they recommended another model, but a very careful model. It wasn't, I heard somebody describe it as, giving away drugs. That's not at all what they recommended. If people want to read the report, it is on our website. It's a very careful model about security, eligibility, cost. This would not be free, providing free substances. We want to be equivalent with the illicit market.
And where would the oversight come from then, if not from the medical system?
So, and that, again, that's what the panel said, that we need to be, we're talking about a regulated system, just like with liquor or cannabis. Smoking isn't regulated, but a regulated system where government sets the rules, and then there would be criteria for those who want to distribute. Here are the rules, here's the training, here are the regulations, here's how you assess, and then there would need to be oversight.
Okay.
So a very careful, thoughtful process.
BC's Chief Coroner Lisa Lapointe joins me now, and we're asking you, where do we go from here on BC's toxic drug crisis? Our numbers, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And we have a call now from Anne Livingston. Hi, Anne.
Hi.
Hi, thanks so much for calling in. And what did you want to say?
Well, I've been doing this for 25 years, and I think that it's very clear that people who use drugs are viewed with, even by our government, who's preaching these kind of non-stigma messages, that they're providing the most stigma, the most hatred, and the most neglect.
What do you mean?
It's structural. If you look at something, every day I'm organizing in Nanaimo and Surrey, and I used to organize in Vancouver, and I live in Vancouver, so I'm always commuting. But I'm just saying that, something like the methadone program, and then you'll talk to someone and then they'll miss 3 days of pickup for methadone and they won't be given their methadone. Then they go but to the street market. And I just think to myself, how can we be in year 7 of a crisis and nobody's looked at that gap? Because if anyone uses from the street market, I mean, what's the point of a methadone program if you're going to constantly punish the people that are on it? And I think the failure rate of that program alone is a real indicator of when you allow the doctors and the College of Physicians and Surgeons to run something, they won't listen. They don't sit down and really say, look, how can we save lives? No, they go, oh, this is a very dangerous drug and we're in charge and oh my God. And they have this bizarre
Isn't it a
sense of
dangerous
their
drug,
own
though?
importance. Pardon me?
Isn't it a dangerous drug that does need supervision?
Not as dangerous as the toxic drug market that people buy from the street. And that's what's so alarming is when you see that these gaps allow for, people crying. They can't get their methadone. And I've gone with them even and said, look, buddy, don't cut her down to 30 mils. What's she going to buy on the street? And just this, switching from methadone to methadose or Metadol D and all of these things are done to these people. They constantly re-victimize and constantly unregulate or switch things. And as we would say, what fresh hell is this? And anytime they do anything that they think is going to make it better, they make it worse because they're not thoughtful, because they don't understand the system. And I think, this is all going on in the background with these record numbers of homelessness and the welfare rates exceedingly low. I mean, they were bad enough before inflation, and now they're just excruciatingly low. No one talks about it.
They are intertwined, certainly, Anne. And so,
Yes,
where do we go from here then? We had this, it sounds like you support what the Death Review panel was proposing.
Absolutely.
The health minister has said we're not considering that. What's the next step? Where do we go?
Well, if we go to court on this, we'll win. And that's why they never take us to court. I've run, 7 or 8 overdose prevention sites and everyone, it's illegal to do that. And I go, yeah, well, you sure can't get arrested doing it. And these things need to come to a head, and we need to actually have a real close examination of what's going on. It isn't legal to allow thousands and thousands of people to die. We have a provincial health officer. We have Health Canada. We have learned doctors. We have all these researchers, and yet we just watch in horror and count dead bodies. That is not a Canadian thing to do. We need everyone to come together and figure it out. And I thank Lisa Lapointe for her comments.
I thank you for your call, Anne.
Yes.
That's Anne Livingston in Vancouver, a longtime activist in Vancouver. And Lisa Lapointe, why does there seem to be a disconnect? You come out with your report every month and just lay out the dire numbers once again. There are recommendations from this death review panel. The province has, moved forward with safe supply, with decriminalization, but there does seem to be this disconnect. You advocate for certain solutions, and the province has its programs, but we're still here. How do we get past that?
Yeah, it is very challenging, Michelle. There are a number of things going on, I think. One is, for so many decades, the message was drug use is bad, and nobody's advocating for drug use, but that drug users are bad. And of course, we know that drug users, people who use drugs, are all of us. Every community has people who use drugs, whether they're over-the-counter drugs, whether they're prescribed drugs, whether it's alcohol, whether it's cannabis. Different drugs are used for different reasons by different people, and there are different reasons, whether it's trying to manage pain, physical pain, emotional pain, trauma, acquired brain injury. There are all sorts of things going on. So there is, as Anne mentioned, there is a stigma. There certainly is a stigma that I think we need to overcome from decades long messaging that bad people do this. This is not bad. These are not bad people. These are regular people. And I can tell you, I've had conversations every week with families who say to me, I never thought we'd be here. 2,375 families lost a loved one last year. In 2020 or 2021, they didn't know that they would be part of this crisis. And they said, now we're living a nightmare. we never realize. And it can be your brother, your sister, your child. It's people across our province for a number of different reasons. And the response that we should go back to the way we've always done it, where we criminalize people and punish people who are already experiencing so much harm, it just makes no sense. We have the means to stabilize people. We have the means to save their lives.
Okay.
We have the means to stop the chaotic drug trafficking that happens in our communities. If government decided to, provide safer supply, give people an alternative.
Are you concerned that there's a bit of a rolling back there when it comes to recriminalization? With more limits as to where drugs that are exempt for possession are able to be present, things like parks, around playgrounds, and a conversation, the BC Conservatives speaking about we would bring back recriminalization. Are you concerned that there's a rolling back of that?
I am concerned about that because I know the people who are dying, in that I see their histories and I see their families, and they are people who are deserving of our compassion. They are members of our community. So when I see them being vilified and ostracized and stigmatized, it makes me very sad, and it makes me very afraid for them, quite honestly. And it makes me afraid to think, what are our children hearing when they hear all this talk about vilifying people who use drugs? How open are our children going to be to coming to us if they need help for substance use or talking about what's going on in their school?
Okay.
It's going back to that era of shame and hiding that got us here in the first place. So, I have asked for data around open drug use in public. It's not available. I certainly have heard the concerns expressed by mayors in different communities.
Mm-hmm.
And I can't help but wonder and think that we're likely seeing a juxtaposition here between decriminalization and homelessness. We know that even people who are making minimum wage in some of the cities in our province can't afford to rent anywhere to live. So are people using their drugs publicly because they don't have anywhere else to use them? They are homeless, and pushing them into back corners and alleys is absolutely contrary to the message that we've been trying to give for the last 7 years, which is don't use alone, because we know that 80% of those who die use alone.
Okay. Lisa Lapointe with me, BC's Chief Coroner. Let's take some of your calls now as we ask, where do we go now on BC's toxic drug crisis? And Michelle is joining us from Victoria. Hi there, Michelle.
Hello.
And what did you want to say about what needs to be done now?
Well, I'm just going to say how easy it is to end up having to use street drugs. My husband's on long-term disability for nerve pain. He takes a mild opiate when he is at like 12 out of 10 for pain. So not every single day, but he went back to get the prescription renewed. He doesn't have a family doctor. He went to a clinic, and the doctor there said, I can't prescribe you an opiate. So what is a person supposed to do when an actual doctor won't prescribe a drug that is available by prescription? And luckily he still had some, and then got to see a different doctor a couple months later and then got a prescription. So what would he have done if he didn't have his, and how easily he could become one of these statistics we're talking about?
And what was he told anything as to why
Some doctors apparently, I guess, cannot prescribe opiates. So even if you have an appointment with an actual GP, that does not guarantee that you will get the drugs that you need.
Okay. Michelle, thank you very much. All the best to your husband and his recovery. Is that correct, Lisa Lapointe, that not all physicians can prescribe in terms of the limits to safe
Well,
supply?
certainly there has been a real fear amongst physicians in terms of prescribing opioids. We know that the College of Physicians and Surgeons did notify physicians across the province several years ago that they would be monitoring opioid prescribing. And of course, that's in response to some of the stories that we've heard out of the States in terms of excessive opioid prescribing. And I think there was a little bit of a backlash. Certainly, we've seen that in the coroner service where physicians were afraid to prescribe. And so we have seen cases where people cannot get the opioid prescription that they need to manage their pain. And there are so few avenues for alternatives because of the wait lists and the lineups at every door for a different pain management. People turn to the illicit market, and it is such a dangerous, toxic market. And that is not an uncommon story where somebody has suffered an injury, and now the illicit market is where they're purchasing their pain medication.
Right, as she was saying, it's very easy to be led down that path. Michelle is up next in Burnaby. Hi, Michelle. What did you want to share?
And now the illicit market is where they're purchasing their
I'll get you to just turn down your radio if you don't mind, Michelle. Hi, Michelle. Are you there?
Hello?
Hi there. Thanks so much for calling in.
Hi. Good topic. I'm pretty fragmented right now. I'm very passionate about this. I'm very angry. I have barely been able to function since I lost my son. He was 31 years old, January 19th of 2022. He was found overdosed by his girlfriend. He went to St. Paul's Hospital that day because he had wanted some help with mental health. He had been struggling to stay clean, but apparently had been doing okay. They told him to come back in 2 weeks. They gave him a phone number. He was beside himself, trying to get out of this dysfunctional relationship. She was a drug addict as well. And I think he probably felt really hopeless, and he went out and got his drug of choice and died. And she found him. And, the ripple effect that this is having on our society is freaking devastating. Okay? He left behind a 14-year-old son and a mother and friends and family that love him. And he was talented. He was beautiful, handsome. He knew he needed help. He was trying to get out. And when you don't have resources, when you don't have somewhere where you can go, when you want to save your own life, like, what's a person going to do, right?
Yeah.
Like, it's criminal what's happening. And, companies should actually be implementing government should be implementing a mandatory FSEAP program for their workers. So any worker that is at work and they're struggling with anything, addiction, whatever, homelessness. I mean, in my line of work, I see so much addiction. I'm in construction. So I see guys coming to work, mostly men, who are homeless, who are struggling with addiction, who, are just trying to earn some kind of a living. But, there aren't a lot of resources, right? But I mean, this is becoming such a huge problem that it should become mandatory that companies have something in place for their workers where they can go when they have issues, right? I mean, so I'm thinking specifically addiction, because it's mental health in the workplace is severely lacking. Distributing a safe supply, I think it's a good idea, but also, putting it into a big program and having people trained and ORU qualified and getting people, like on a safe supply. I mean, it's a slippery slope because that's creating it's harm reduction, but it's also creating an environment where people don't necessarily have to accept responsibility for their actions, right? And it's really tricky. It's very tricky. It's a choice to use. It's a choice. But, you know, if you don't have those resources that are there for you, and, you know, we got to do better. This is Canada, right? We've got new immigrants coming into this country who we're struggling to find work here. People that are from this country, and then we're you know, we've got immigrants coming to this country that, what are they going to do? How are they going to deal with homelessness and being out of work? They're going to be addicted too. So we're just creating a whole other very scary, unsafe, new population of people coming into like an already drug-ridden cesspool that's not being managed. You know, unfortunately, I was on this show previously and talking about the same thing. And here I am again a year later or whatever it is, talking about the same thing. You know, I would like the federal government to do more.
Michelle, I think I remember that conversation, and I can hear all the emotions and the thinking that you've put into this. I'm so sorry for the loss of your son, 31 years old.
Yes, well, I'm fighting for him. So, and all the others that don't have a voice or don't have family or don't have resources, right?
It's about that.
Thank you.
Yeah, thank you very much for calling. I hope you take care after this call. I'm just going to mention that BC's Alcohol and Drug Information and Referral Service is at 1-800-663-1441. 1-800-663-1441. You can see it on our screen as well on our live stream. I'm just going to go back to Chief Coroner Lisa Lapointe on that. She was talking about this a year ago, and she lost her son January 2022. He tried to get help, and it wasn't available. And this is what the previous caller was talking about as well. The resources aren't there. And so safe supply, I know you've talked about this, safe supply is one thing, but where is the focus on those resources that Michelle was calling for?
Yeah, and my heart goes out to Michelle, and I'm so sorry, Michelle, for your loss. And this is a history that I hear often from families, and our coroners hear often from families, people who are using drugs and who actually would like help to move away from substance use. And the doors are all closed, or there are long lineups at every door, or they are costly. And that's the other challenge. And I've had families say to me that, you know, parents are burning through their retirement savings to pay for treatment for their adult children, or, you know, psychological counseling sessions, other sessions that they need because the services aren't there. So it is a very common concern that I hear, the gaps. And we know that, as I mentioned, there are 3,277 treatment beds in our province. We've had 3 death review panels, and every death review panel has strongly recommended an evidence-based continuum of care for people struggling with substance use. And that takes time to build. And this third panel said that is necessary. It is essential. And everything Michelle has said is absolutely necessary, including employee referral programs for mental health and substance use challenges. But while we build that program at a time when we are challenged with waits for all sorts of medical health procedures and visits, safe supply will save lives. People are dying on waiting lists. And really that was the panel's urgent message, is that this is not meant to be an expansion of drug use. Nobody's recommending that more people should be using drugs. But for those who are and can't access services because services aren't there for them, this is a means of keeping them alive and stabilizing people so that they can live another day, another week, and hopefully at some point the services will be there to help them move away from their substance use. It is a very compassionate approach.
Okay.
And I think that some of that has been lacking in some of the rhetoric that we've been hearing lately.
Lisa Lapointe, I will have to leave it there. Thank you very much for your time. I appreciate your joining us and taking these calls.
Thank you very much. I always appreciate your attention on this.
You take care. Lisa Lapointe is BC's chief coroner. It is 12:35, 1:35 in the Mountain Time Zone. You're with BC Today here on CBC. Thank you so much for joining us. We'll continue to talk about stigma and what impact that has on the conversation around mental health. It is, in fact, one of the focuses at the Vancouver Asian Film Festival that's on this week. They're tackling the topic of mental health and stigma within the Asian diaspora. So we're asking you, is mental health still taboo among your family and your friends? And how can we make it an easier conversation? That's coming up after the CBC News Update with Robert Zimmerman.
Good afternoon. Families and friends of two 18-year-old UBC students killed by a drunk driver 2 years ago made extremely emotional victim impact statements this morning as the 22-year-old driver cried in the courtroom. Emily Selwood and Evan Smith were killed when Tim Gurner lost control of his SUV while driving more than 100 kilometers an hour in a 40 zone. The Crown is seeking a 3-year jail term for Gurner. Vancouver police believe high-risk sex offender Randall Hopley is still somewhere in Metro Vancouver 2 days after he walked away from his Vancouver halfway house and removed his electronic monitoring bracelet. Hopley was facing a court hearing today on charges he allegedly violated supervision orders. Hopley is a violent offender with convictions for assault as well as sex crimes against children. And Premier David Eby says Ottawa's pause on carbon pricing for heating oil is unfair to BC because this province collects its own fuel tax and is not eligible for the federal relief. Eby and the other premiers have wrapped up a meeting in Halifax today where the tax and healthcare were the main topics. And now the forecast on the North Coast. Periods of rain this afternoon with a high of 9. Highs reaching 3 with a mix of sun and cloud in the Peace. In the central interior, cloudy with a high of 5 degrees. Highs up to 7 with rain in the Kootenays. In the southern interior, periods of rain with a high of 6. And for Metro Vancouver, Greater Victoria and the Fraser Valley, rain this afternoon with highs around 12 degrees. I'll have more local news at the top of the hour. Now back to Michelle with BC Today.
Thanks so much, Rob. That's Robert Zimmerman in the CBC Vancouver newsroom. And a travel note now that rock slide last night west of Keremeos has closed a 6-kilometer portion of Highway 3. Now, the regional district of Okanagan-Similkameen has also declared a state of local emergency for 7 days in the area. The next update is expected in about 20 minutes from now at 1 p.m. But for now, drivers are being diverted to alternate routes. And Drive BC says a detour is available along Highway 7 to Highway 97C. We're showing some shots of Highway 3 right now at Keremeos Bypass Road in our live stream. And the rock slide has also resulted in an evacuation order for 2 properties. But again, some detour routes being recommended by Drive BC and another update coming for you in 20 minutes from now. It is 12:39, 1:39 in the Mountain Time Zone. Well, the 27th Annual Vancouver Asian Film Festival is on until Sunday, November 12th, with the most films ever in the festival's history. And today, the festival's virtual program gets underway, which means anyone in Canada can see the films. Now, this year, one of the common themes in films being screened is mental health and stigma within the Asian diaspora. 17 films tackle that topic, including this feature film from India. The film is called Molly, and we'll hear more about that in a moment. We're asking you on the open line, is mental health still taboo among your family and friends? How can we make it easier to talk about? You can call us 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. You can email to bctoday@cbc.ca. And I'm joined by 2 guests now for this conversation. Siddhartha Murjani is Director of Programming of Feature Films for the Vancouver Asian Film Fest, and Tanya Jade is Director of the short film Wallpaper, about a young woman who's trying to process a jarring encounter. Tanya and Siddhartha, welcome so much. Thanks so much for joining us.
Thank you, Michelle. Thank you for having us.
Very good to have you. Siddhartha, tell us why mental health is such a focus at this year's festival.
So in terms of programming, we program the themes based on the films we got. I think because we were coming out of after the pandemic year, So a lot of people have made films focused on that. But it's when we talk about mental health and when we talk about art, it's not that it's specifically it will just focus on that. It's told in a very creative way.
Right.
For example, there's a film called Stranger that played, and it talks about how a couple just woke up one day and the partner doesn't recognize the face of the husband. And it's like when you are together with someone, but things change immediately. So the stories are told in a very creative way, but it tackles mental health.
Right. And so then, Tanya, how does art help us to have these conversations? How do films help us to have these difficult conversations?
Well, I think there's a way of being able to utilize the medium of film through a sensorial experience, whether it be soundtrack, whether it be visuals, and we're able to kind of compile our feelings into a visual and audio sensorial experience. So we're able to provide a relatable kind of experience to provide catharsis and nostalgia to those in the audience watching.
So it's about the story?
It's about the story, but it's also the way the story is communicated, because people resonate with different things to be able to identify their own feelings and acknowledge them, which I think is a huge part of people trying to figure out what's going on inside.
Right. And so much of that is, right, we have trouble having these conversations. So how do you take the experience of watching a film and exploring your feelings about that topic, and then being able to expand that to having a conversation at the kitchen table with your family? Siddharth?
So for me, I gravitate a lot to comedies, because for example, I made a film called Gratitude a few years back. And the theme is gratitude, but it deals with loneliness. So it takes place on Valentine's Day. Couples are coming in, they have no reservation. They're giving the server problems about getting a reservation. So they sit down, then a single guy comes in and he has a reservation. Why does a single guy have a reservation on Valentine's Day? And then it's talking about appreciating what you have, regardless whether you're single, complicated, or in a relationship. So I think what films do is that it allows you to escape, because you're watching a film, you're like, oh, that's not me. But then,
Right. It's not real.
Yeah, it's not real. But then you resonate with it.
Right.
And then you start thinking, and then you start reflecting. Great films do that, like what Tanya was saying, with the sound, with the execution of the cinematography, the direction, all that. Yeah.
Well, Tanya, why don't you tell us about your film Wallpaper?
My film Wallpaper is based on my own experience that I had with a friend. It kind of places a spotlight on my conception of female fear and how we always need to expect the worst, whether we're walking alone to our car, in an elevator alone. There's always this lingering mortality where we can't afford to be wrong if someone is walking behind us. So we always, as women, have our antennae up. And I definitely had an incident which the film portrays with a friend who I let stay at my house, and I then later woke up with him standing over me in bed, and he was beyond intoxicated, and I'll never know what actually his intention was, because he claims he doesn't remember and essentially nothing happened. But it
That's
definitely,
frightening, though.
it was terrifying, and even the conception of time and how we disassociate in moments of fear and confrontation with what's going to happen next. I just thought it was a very interesting grey area of trauma and assault where actually no crime was committed. But it definitely changed how I behave moving forward. I've never let a male friend stay on my couch again. So I just found that interesting to be able to portray.
And explore, because you then follow through, what happens to her in the days to come, or how she processes all of that. And it's interesting how there's so many different stories, and I guess that represents all the different struggles that people have. I mean, you have a film that I believe is called Dati, and it's about a young man whose grandfather has dementia, and it's escalating, and the struggles of that. A film about, I think it's called Faces, about a young Asian Canadian woman a girl who is mocked for her Asian features, and so she has to process that. I mean, the diversity of the kinds of struggles that people have, is that part of it too, to show these stories and perhaps one of them, some of them will resonate in some kind of way with all the different experiences people have.
Yeah, for example, every film that we program doesn't necessarily will just focus on one particular aspect. Like you were talking about the features, or maybe Tanya's film talk about relationship and how that can affect people. And sometimes it's also not so obvious. It's more subtle.
Yeah.
Things like, for example, there was a film called Revelation that's in the virtual filmmaking, and the filmmaker is from Toronto, and it deals with about a guy who's giving a sermon. So he's talking, but in a parking lot. So he's giving people like advice on to repent, but in his drink, it's a McDonald's drink, but then he pours some alcohol in it. So he's not perfect either. So sometimes we look at stuff, we look at things, and we're like, oh, we're kind of judging it.
You make a conclusion.
Yeah, make a conclusion.
Yeah.
But these films allow you to open your mind. Like, for example, when I watch Tanya's films, I'm like, oh, wow. Yeah, I mean, me as a guy, I was like, I learned so much from that her film. Because I was like, oh, wait, I never want to be in that position, you know? Yeah.
Can I ask you, our previous conversation was with BC's chief coroner and about the ongoing toxic drug crisis here. And we talked a lot about stigma and how that gets in the way of solutions, that can get in the way of solutions, and how stigma prevents people from either seeking help or not using a loan. And that's been one of the issues. How big a problem is stigma when it comes to mental health? Like, why are these filmmakers wanting to explore mental health in their films?
I mean, I think it's really crucial to open the conversation. And that's why the great thing about Vancouver Asian Film Festival is that the virtual program is available nationally so that anyone in the country can access it. And still, within the Asian community, mental health is not really prioritized. I mean, there are studies done. There's only 2% of first-generation Asian Canadians actually utilize mental health services when they're in need. 10% of third generation. So if 23% of Canada is a visible minority, that being South Asian, Chinese, Black, Arab, they're clustering the largest groups of them. So that's a huge percentage of the national population that isn't really addressing when they require help. And especially post-COVID, when there was so much fear and anxiety about being Asian, outside of the isolation that happened through COVID, I think the ripple effect of that still flows through the Asian community, and these conversations can be opened up through seeing films that you are not the other, they are your stories. And then children can have those conversations with their parents.
Have you been able to have this conversation, in real life, outside of films, with friends and family,
About
mental health and stigma?
Absolutely.
Really?
I mean, not with my family. Per
No.
se. My mother is still very much traditional cultural Chinese. To get through it, don't feel that way. And the priority of just taking control of oneself and being on top of your feelings, or not even acknowledging them, is still very much in her culture. And although I embrace that culture as well, I've been trying to encourage her to talk more about how she's feeling too.
Well, what's that like for you, that process?
It's difficult. I think it's quite complex. And, she's from Singapore. She was born in the 50s. So she comes from a different place and time where priorities were different. And it is a luxury to be able to talk about our feelings. You see what's going on in the world right now. Of course, we can't help but feel the pressures of perceived weakness, and through the stigma of Asian culture of being too weak to manage your feelings. But in everything that's going on in the world today, it doesn't decrease the importance of how we manage ourselves in society as well. And trying to have those conversations with my mother is not easy, but perseverance is key.
I appreciate your sharing that. Thank you so much. Siddhartha, what about for you? You know, as someone who has viewed these films and you've programmed them, how do you take that into your real life?
So, in terms of my family, I have a good relationship with my mom. We talked about a lot of things, but this has developed throughout the years. We had to work on it, and because I came from kind of a broken home, so I had to actually work a lot on myself to understand how my upbringing affected me as an adult in terms of my intimate relationship with friends and stuff. I also do have so me and my guy friends, we have a Monday mental health checkup actually.
Oh, wow.
It's just a few of us, and we will be like, Monday mental health checkup, what's up everyone? Let's check in, you know?
Wow.
So yeah, I know that's not common, especially among men, but I'm lucky to have like the three of us to check in and stuff.
Yeah.
And I'm always, I know it's a stigma, especially among men, to like talk about this, feelings and stuff. And this is why I think films are very important. Because as I said, when you watch a film and you resonate, and it's like a comedy or something, but then you see, let's say, someone goes through that, and you're like, oh wait, I'm going through that. Oh, that's okay to talk about it.
Right.
Oh, it's okay to open up. Oh, okay. So sometimes someone has to take the first step to kind of, and I think film does that, and the Vancouver Asian Film Festival does that.
Yeah. I really appreciate you sharing that too, all
Thank
the
you.
work that
Thank
you
for
put in.
asking,
And so what's been the reaction then from audiences? I know you start the virtual program today, but it opened on, the festival itself opened on November 2nd. Even just talking about mental health, what's been the reaction from audiences?
I think everyone's been really perceptive. During the program last night, there was a short film called Rock the Cradle, and it is about the trials and tribulations of trying to manage a newborn child, maybe without the support that other people may have. But the story is an East Indian family, and I think part of diversifying the film industry as well is having a very universal theme of struggling with early motherhood in a realm that just happens to be of East Indian culture, and then there are those complexities of that culture and the parental influences and expectations that flow into that as well. So I think giving visibility of the fact that these very universal themes just flow through every culture is a great way to just bring eyes onto what have previously been deemed as minorities in the film industry.
Yeah, representation with the struggles as well when it comes to the struggles and the issues that we face. We have Ruth on the line as we ask you, is mental health still taboo among your friends, your family? We've just heard some very personal accounts from our guests here. You can let us know too. And Ruth is on the line from Williams Lake. Hi, Ruth.
Hi there.
Thanks for calling in. Yeah, what did you want to say?
Yeah. Well, I see a lot of stigmatization in mental health. I've worked at one of the shelters up here, and people with mental health problems often get turned away because it's felt that they're too dangerous at times for the workers. However, I often was able to calm people down, usually giving them something warm to drink and giving them some food and treating them with respect.
So
I think makes a huge difference. And I'd also like to tell you about something that happened on Saturday at the library here. There's a guy who's about 25, and he's got a brain injury, and he had a seizure outside the library. And I was getting him to sort of calm down and trying to get the paramedics to not scare him so much, because he was looking at the ambulance as if it was a paddy wagon, and he was very fearful. So I was trying to get him to calm down, and I got lucky, and his aunt, who's on the local band council here, she was driving past. And so she was able to help me because the paramedics wanted to involve the RCMP because he wasn't responding to verbal commands well. But that's because he just had a seizure and he was in a post-ictal state. And so he was a little confused. And if the RCMP had come along, they wouldn't have understood that he's a vulnerable person. They would have just attacked him and tasered him because he's not responding to verbal commands the way they want him to.
Ruth, you've touched on a lot of issues there. and you started with the stigma that people face. Thank you so much for the call from Williams Lake. The perception of people, right? How we understand people who may be struggling, and she felt that this fellow was misunderstood, and that happens a lot with people who come to the shelter for aid. As we wrap up here, then what would you like audiences, besides taking in the films for their artistic qualities, what do you want to take from the What do you want them to take from the messaging?
I think one thing I find, for me personally, I'm not a therapist, I'm not.
Yes,
What
fair
works
enough.
for me
Sure.
is when I'm going through a difficult moment, I spend time with nature. I find simple stuff to be, like I bike a lot. So biking in Stanley Park, just in nature, helps me a lot. Having friends to talk to. And I know like some people do not have friends, but there are resources where you can call. Take a lot of self-care. And self-care could just mean having a good shave, a nice shave for your beard, going to the barber. Simple stuff like that helps a lot.
Checking in on your friends.
Exactly.
Like Mental Health Monday.
Yeah.
What about for you, Tanya?
Similarly, I take a lot of peace in nature. Helps to clear the mind. I cling on to anything that makes me feel good. I love to cook, so even just knowing that I'm nourishing myself just helps kind of put me back in my feet a lot. And I think just reducing my own previous stigma about mental health and what it means and not seeing it as a weakness. And there are some great resources in BC. And if there are language and cultural barriers, Pathways delivers services in English, Mandarin, and Cantonese. So it's knowing that there are resources out there. You are not alone, and reaching out when you need to.
Thank you so much to both of you for this conversation. I really appreciate your candid conversation. Thanks so much.
Thank you for having
Michelle.
us, Michelle.
Siddhartha Moorjani is Director of Programming of Feature Films for the Vancouver Asian Film Festival, and Tanya Jade is Director of the short film Wallpaper. And the Vancouver Asian Film Festival goes on until Sunday, November 12th, and its virtual program starts today. And tomorrow, we're going to get some soup recommendations, so get ready to call in with your favorite soup recipes. That's coming up on Wednesday. That's it for our show today. Thanks so much to everyone who called in. I hope you have a great afternoon.